Hey guys, welcome back to my series where I make nursing skills easy. Today we are focusing on auscultation of the heart, a fundamental skill in nursing. Auscultation allows identification of abnormal heart sounds that can alert healthcare providers. When the stethoscope is placed at the correct site, we can hear the heart valves closing. Normal heart sounds have a steady 2-beat rhythm. The first sound is called S1 or a lub. The second sound is called S2 or a dub. You may also hear abnormal heart sounds such as murmurs or friction rub. It is essential that you place the diaphragm of the stethoscope on the correct landmark to ensure accurate heart auscultation. You can start by feeling for your patient's suprasternal notch or the sternal ridge to ensure that you can count the intercostal spaces correctly. Take note of the ribs and the space in between them. For example, rib 1 and rib 2, the space in between that is called the first intercostal space. Also, the midclavicular line is referring to halfway through the clavicular bone, approximately the nipple line. So by counting the correct intercostal spaces, you can put your stethoscope on the correct landmark. Aortic, right side, second intercostal space. Pulmonic, left side, second intercostal space. Erb's point, left side, third intercostal space. Tricuspid, left side, fourth intercostal space. Mitral, the point of maximum impulse, also the apex of the heart, left side, fifth intercostal space. At the mid-clavicular line. A memory tip is the acronym All Pigs Eat Too Much. Pop quiz, when is it appropriate to use the bell of the stethoscope for heart auscultation? Let me know in the comments.